So when we ask that question, I think we're really talking about the risk of psychedelic use and the risk specifically for mental health in the context of psychedelic use. Schizophrenia is a complex and often progressive illness that involves chronic or recurrent episodes of psychosis. So generally, I would say no, it's not a particular risk of using psychedelics. You could certainly have brief states that may, qualify, diagnostically for psychosis. But generally, it's about entering into non-ordinary states of consciousness that may be unfamiliar to someone. So it's really important that somebody using psychedelics have proper preparation, proper support and guidance during the experience, and proper integration of the experience afterwards. All of that helps ground and contextualize what may be unfamiliar or very unusual or very intense states that someone might experience with psychedelic use. That said, it's really important to be aware of your own individual risk factors. So a history of psychosis within yourself or a strong history of psychosis within your family is a risk factor for developing a more complicated or persistent psychosis in the context of psychedelic use. Not that that will necessarily happen, but it would be important to be aware of that and to disclose that to anyone that you were doing psychedelic work with, so that you would all be aware of that. So again, really the key is helping somebody understand what to expect in the experience, supporting them during the experience, and then really where we are putting a lot of emphasis right now in the field of psychedelics is on integration. So support afterwards, helping people understand and helping people contextualize and recontextualize their experience, helping them to implement the new insights or understandings that they've gained or the heightened experiences that they've had. Certainly in psychedelics and without psychedelics, you can develop what Stan Grof would have called a spiritual emergence or a spiritual emergency, which is something that can be dealt with through skilled and insightful support where people understand the nature of non-ordinary states, understand that terrain, like the expanded psyche, the expanded context of what's possible to experience as a human, and to help really ground that for people so that it's not overwhelming, so that people don't become overly disoriented or fearful at the time, and so that they understand afterwards sort of where they've been and some of the significance of that. And they have somewhere that they can really share that and talk about that, where people will understand maybe what they've experienced and be able to help them integrate that.